Hello and welcome to Santa Fe Nursing Labs. Today I'm going to be demonstrating IV administration using a primary line. Primary IV lines are commonly used to administer IV fluids or continuous medications to patients. Intermittent medications can be administered using a primary line as well. However, part of the medication, about 26 mL, is wasted in the line when the tubing is changed. I'm going to wash my hands. Hello, Mrs. Duncan. I'm going to be getting ready to get your IV medication, so I'm just going to check your room, make sure we have everything here. So before I prepare my medication, I need to check my IV sites and my IV lines. So I can see I have my Alaris IV pump here. I have a channel to administer my medication, and I do not have any previous lines, so I will need to gather all new tubing. Ms. Duncan, I'm just going to take a look at your IV, and you have your peripheral IV here in your left hand, and I see there's no signs of redness or infiltration. When administering medications to patients, you always want to make sure you follow the 8 rights of medication administration. The first right is the right patient, right drug, right dose, right time, right route, right reason, right documentation, and right response. We're going to check Ms. Duncan's chart for the correct dose. We're going to double check it against the drug guide. We're also going to make sure that we know how quickly we're going to administer the medication, and we're also going to check for compatibility. She did not have any other running IV medications, so we don't really need to, in this case, worry about compatibility. So I'm going to double check her chart and then pull my medication. So I can see here that we have some normal saline that is due for maintenance IV fluid, and I want to know my rate of administration, and my order detail says that it is going to be at 75 mL per hour. Okay. So now I'm going to go ahead and get my medication or my fluid out of the medication cart. So I have my solution that I'm going to be administering. I have my primary tubing set. I have my normal saline flush in order to check patency of her peripheral IV, and then I have my labels for when the bag and the tubing needs to be changed. So I'm going to double check my medication or my fluid against my MAR one more time, make sure I have the right drug or fluid. So I have my normal saline, and my ordered medication or solution is normal saline, sodium chloride, and I'm going to be giving it IV at 75 mL per hour. So this is my primary tubing setup. You can see over here that the bag tells you how many drops per ml, and then it also tells you over here how much fluid you need to prime your IV line. So for this primary IV tubing, you need 26 mL to prime from start to finish. When labeling your tubing, there's certain information that you need to include. For IV tubing, you need to make sure that you include your initials and then the date that you hung the tubing and the date that the tubing expires. The expiration does depend on whether you are using the tubing for continuous infusion or whether it's for intermittent infusion. Always make sure that you follow your hospital's policy and the most recent infection control guidelines. When labeling your fluid bag or your medication bag, you always want to make sure that your patient's name and date of birth is on the bag, their MedRec number is on the bag. You also want to include when the bag will expire. So what date and time did you hang the IV bag, and what date does it expire? Again, the expiration is going to vary depending on the most recent infection control policies. Next, I'm going to administer my medication to the patient. First, you need to explain to the patient what medication you are administering. We're now going to scan the patient and scan our medication. Okay, Ms. Duncan, I just need to take a look at your armband here, and can you confirm your name and date of birth for me? Perfect, and I'm just going to scan your band. Now I'm going to scan the medication. And this is going IV, and I confirm that it is at 75 mL per hour, continuous until discontinued. Okay, Ms. Duncan, I'm just going to come around to the other side where your IV tubing is, or IV pump is. So I'm going to go ahead and put on my gloves and then get my IV tubing ready. I want to make sure as soon as I pull my tubing out that my roller clamp is engaged. I'm going to attach my label to my tubing. Okay. I'll now open up my fluid bag, attach my patient's label. I'm going to confirm again that my tubing is clamped before spiking my bag. It's very important that you maintain sterility of the spike. Hold your bag upside down, especially a large bag. It's a lot easier to spike when it's upside down. And I'm going to spike my bag. Okay. I can then hang my bag on my IV pole. Okay. Next, you want to prime your tubing, which means you're going to get all the air out of the line. In order to prevent air bubbles, you want to fill the drip chamber. The drip chamber is this part right below the IV bag, and you want to fill it at least halfway. Okay. In order to control how quickly your tubing is primed, you'll want to use the roller clamp. A little tip to make sure you reduce the number of air bubbles is to hold the injection ports upside down as you prime them. So I'm going to slowly release the roller clamp. Hold my injection port upside down. I make sure the next ones are upside down as I go through the tubing. Okay. I can now go ahead and put my tubing into my Alaris pump. This is the brain or the PC part of the Alaris IV pump. This is where you control your settings. This extra part on the side here is called your channel. That is where we're going to be placing our IV tubing. I'm going to open up this part, slides in right over here and clicks, and hold the door closed of the channel and lock in place. So now we're going to get ready to flush Miss Duncan's IV line to make sure that it is patent and working. You can see her line at the top here has what's called a Kuros cap. It is an alcohol disinfecting cap. Some hospitals use them, some hospitals do not. We are going to follow the strictest guidelines for our area hospitals, which requires us, even when they have a Kuros cap, to still scrub the hub, meaning you're still scrubbing the injection port with alcohol before accessing. At Santa Fe Nursing Labs, we use an acronym called SASH, which stands for Saline, Administer, Saline, and then heparin. These are general guidelines that are used for flushing any type of IV line, either a peripheral or central line. The amount of fluid that we use falls into majority of the evidence-based guidelines for flushing. Depending on the hospital you go to, you want to make sure that you follow their policies for flushing peripheral and central lines. I'm going to get the air out of my normal saline flush syringe. So I'm going to go ahead and remove my Kuros caps. These are one-time use only. It is recommended that you scrub your hub or your injection port for at least 15 seconds and then allow it to dry. Once I clean the injection port, I do not want to touch it. I'm going to remove the cap from my normal saline, attach my syringe, unclamp my tubing, and flush with the 5 mLs. So I'm disconnecting my saline. These saline syringes are one-time use, so you cannot use it again. I'm not touching the end of that, and now I'm going to connect my IV tubing. I'm going to now set my Alaris pump. My order was for 75 mLs per hour of my normal saline. This is a new patient. We are not on a peds floor, we are on an adult med surg, so you're going to select the correct unit. Her ID number, I can either check my chart or we can check her band here real quick. I'm going to confirm. And then my infusion is going through channel A. You can see this one says A, this one says B, and this one says C. So we are on channel A. We are going to follow, we're not giving a drug, we're giving IV fluid. Guardrails is a system that is designed to prevent medication errors. We have plain normal saline, so we're going to select out IV plain. Is this correct? Yes. Our rate, as per ordered, was 75 mils per hour. My volume to be infused, that's how much I want the pump to infuse. This can vary depending on where you work. Some hospitals will only allow you to place 4 hours worth of fluid. So the unit that we're on requires us to only put 2 hours worth of fluid. So we're gonna go ahead and set this for 150 mLs. So in 2 hours, this IV will beep telling us that the infusion is complete. We are now going to unclamp our roller clamp and go ahead and hit start. You want to watch the drip chamber to make sure that your fluid is dripping and administering. Okay, Ms. Duncan, I see that your IV is complete and the doctor has ordered to disconnect the IV fluids. So I'm going to go ahead and take care of your line. So let me wash my hands. Put on gloves. I'm going to go ahead and just silence this so it doesn't keep beeping on us. Okay, so I'm just going to turn off my pump here because I do not need it anymore. Okay, so now we're going to finish that acronym, the SASH acronym. We did our first saline before we administered the medication. We then gave our medication or our fluid. We're now going to finish with a second saline. She has a peripheral IV that does not need the heparin. I'm going to go ahead and get my air bubble out of my saline. Okay, so now what I need is a Curo tip for the end of my IV line. If I had to leave my IV line just open, I would not be able to use it again. It is considered non-sterile. So to keep it sterile, I'm going to use one of the Curo tips. And then hang it back on my pole over here. Okay. I then need to flush my line one more time. I'm going to scrub the hub for 15 seconds because I did put down my end cap on my port. Okay, allow it to dry. I'm going to go ahead and flush with my 5 mLs. So depending on the type of valve that you have in your peripheral IV lines, you may need to clamp with positive pressure, or you may have a positive pressure valve where you would disconnect your syringe and then clamp. So you want to follow whatever type of valves that your hospital uses. These are negative pressure valves, so when I'm finishing my flush, I need to maintain pressure as I'm flushing, because if I do not maintain pressure as I'm flushing, blood can flow back into the catheter tip and occlude the IV line. I'm now going to go ahead and place a Kuros cap on the end. Okay, Miss Duncan, we are all done. You call me if you need anything. You have your call light right over there, and I am going to lower your bed for you. Okay, I'm going to get rid of my gloves and my trash. This concludes our demonstration. Thank you for joining us, and remember to check out our other Santa Fe nursing videos.